Ever get those lab reports back and you're like, what am I even looking at? Today, we're going to do a deep dive into cardiac lab tests.
Awesome.
So we can all understand what our numbers actually mean.
Yep, love it.
We've got a whole bunch of notes and diagrams today to help us map up the heart.
Okay.
So whether you're getting ready for a doctor's appointment or you just love learning about the heart like me,
Right.
this is the place to be.
It's fascinating how much we can tell from a simple blood test.
Oh yeah, for sure.
It's really like a window into your heart.
Let's start with the one we've all heard of, the CBC.
Okay.
Complete blood count.
Right.
My notes say it breaks down our blood into 5 different cell types.
Yeah.
Red blood cells, white blood cells, platelets. It's amazing how much info is in there.
It is. Each one tells a story.
Oh, cool.
Like red blood cells carry oxygen throughout your body. So if your count is low, it could be anemia,
Okay.
which would explain why you might feel tired.
Oh, interesting. So that's why I'm always so tired. What about if it's high?
If your red blood cell count is high,
Yeah.
it could be a condition called polycythemia,
Okay.
and that's where your body's making too many red blood cells. And that makes your blood thicker and more likely to clot.
Ooh, that doesn't sound good.
No.
So definitely something you want to keep an eye on.
Yeah,
What about white blood cells? Those are our immune system, right?
exactly. They fight off infections.
Okay.
So if your white blood cell count is high, it probably means your body's fighting something off.
So like a cold or flu.
Could be, or something more serious.
Got it.
Your body's way of signaling
Yeah.
that something's up.
Interesting.
And then we've got platelets. I always think of them as tiny Band-Aids,
Okay.
rushing in to stop any bleeding.
And my notes say too few.
Yeah,
And you're at risk of bleeding too many. You could get clots.
exactly. It's all about balance.
Always about balance.
And speaking of clotting, there's specific tests called coagulation studies,
Okay.
like PT and PTT, and these help doctors see how well your blood is clotting.
Oh, interesting.
Especially important if you're on blood thinners.
Makes sense.
Yeah,
So CBC gives us the overview of our blood.
right.
What about electrolytes?
Oh, electrolytes are essential for heart function,
Okay.
like potassium.
My notes have danger written next to abnormal potassium levels.
Yeah, that's because potassium is crucial for your heart rhythm. Too high or too low can lead to some serious problems,
Like what kind of problems?
like arrhythmias.
Oh, right. Those are rhythm problems.
Yes, exactly.
Okay. And sodium?
Yeah, sodium is the main element in our body fluids.
Right.
It helps regulate the flow in and out of our cells.
My notes say severe diarrhea or vomiting can mess that up.
It can, because sodium is so important for fluid balance. When that's off, it affects your blood pressure, nerves, muscle.
So many things.
It really does.
Then there's magnesium.
Magnesium's great.
Yeah.
Keeps that heart rhythm steady.
Mm-hmm.
And it's actually really important for strong bones.
Really? I did not know that.
It is about half of the magnesium in your body is actually in your bones.
So like muscle cramps could mean I need more magnesium.
Could be, especially if you have other things going on like insomnia
Oh, yeah.
or
yeah.
anxiety.
Wow. Okay, so we covered CDC's electrolytes. Now on to something everyone loves to talk about.
Okay, what's that?
Cholesterol.
Oh, yeah.
Good cholesterol, bad cholesterol.
Right.
What's the real deal?
Well, doctors use something called a lipid panel to measure your cholesterol.
Okay.
And there are 3 main types. They look at HDL, DL, VLDL.
I always get those mixed up.
Okay, well, think of HDL like a tiny garbage truck
All right.
that picks up the excess cholesterol in your blood
Okay.
and takes it to the liver to be recycled.
So that's the good one.
It is. Higher HDL is better.
Got it. So what about LDL?
That's the bad one.
Yeah, my notes say it builds up in your arteries.
It does. Imagine it like sludge.
Ew.
Yeah, slowly building up and clogging things.
That makes sense.
Over time, it restricts blood flow.
And then you're at risk for a heart attack.
Exactly. That's why doctors pay so much attention to it.
Okay, so high LDL, bad news.
Yes.
What about VLDL?
VLDL is like LDL's cousin,
Okay.
carries a lot of triglycerides,
Okay.
and high VLDL can lead to plaque buildup too.
So really need to keep an eye on all 3.
We do, but LDL and VLDL especially.
Okay, so that's how blood work gives us a look at our heart.
It does.
But what about actually seeing the heart?
Well, there are ways to do that too,
Oh, cool.
using different procedures.
Before we get to those,
Yeah.
my notes mention something called creatine kinase.
Oh, yes, CK.
It says it's a sign of muscle damage in the heart.
It's an enzyme
Huh.
found in your heart, brain, and skeletal muscles.
Okay.
When those muscles are damaged, it leaks into your blood.
So it's like an alarm bell.
Yes, exactly.
Oh,
And there are different types of CK, which can help doctors pinpoint where the damage is.
that's incredible.
It is.
So blood tests tell us a lot more than we think.
They really do.
Okay, so let's get into those procedures.
Okay.
First up, chest x-ray.
The class
It can
act.
show the size and shape of your heart, right?
Yeah, and it can also show if there's fluid in your lungs.
So it's a good starting point.
It is.
Now this one sounds intense, cardiac catheterization.
It is a bit more involved.
Yeah.
It allows doctors to get a really good look at the heart.
It says here they thread a catheter through your blood vessels to the heart.
That's right. They can measure pressure. See, the arteries even take biopsies.
Wow.
Yeah.
There must be some risks with that, though, right?
There are risks with any procedure,
Right.
like bleeding or infection,
Mm-hmm.
but it's generally very safe.
Okay.
And the benefits usually outweigh the risks.
All right, so now this one sounds a little less intense, electrocardiogram or ECG.
ECG is super important in cardiology,
Yeah.
painless and non-invasive.
Okay.
They put electrodes on your chest, arms and legs,
Okay.
and it records the electrical signal from your heart.
So it's like listening to your heart.
Yeah, exactly.
That's so cool.
That's how we diagnose heart attacks, arrhythmias.
So many things.
Yes.
What about a thallium scan?
A thallium scan is a type of nuclear imaging test.
Okay.
They inject a small amount of radioactive thallium into your blood,
Okay.
and a special camera can track it as it moves through your heart.
Wow.
So doctors can see if there's any areas where blood flow is reduced,
Oh, wow.
which would mean there might be blockages.
Okay, so it's like a roadmap of your heart.
Exactly.
Very cool.
And then there's echocardiography.
I've heard of that one.
Yeah, it uses ultrasound
Okay.
to create images of your heart.
So it's kind of like a sonogram.
It shows the structure and movement of your heart in real time.
Does it show things like heart murmurs?
It can,
Okay.
and it can also assess your heart valves and check for abnormalities.
Wow, so many things.
There are
Okay, last one, PET positron emission tomography.
PET scans are cool.
What is it?
It uses a small amount of radioactive tracer to see how well your tissues are working.
Okay.
So doctors can see how your heart muscle is using energy.
So it's kind of like seeing under the hood
It is,
to see how the engine is running.
yeah, a very sensitive test.
Wow, we have so many tools to look at the heart.
We do, and they all provide unique information.
That's amazing.
It is.
But what about as we age?
Yes,
Do our hearts just inevitably decline?
that's a great question, one we can discuss after a quick break.
Sounds good.
It's true, our hearts change as we get older.
Yeah.
But the good news is a lot of what affects our hearts as we age, we can actually control.
Okay, so it's not all downhill from here.
No, not at all.
Okay, good.
No,
My notes mention risk factors.
Yeah.
And it seems like there's stuff we can change and stuff we can't.
exactly.
Like age, that's just part of life.
It is. As we get older, the risk for heart disease goes up,
Makes sense.
and family history, that's genetics.
Okay, so those are out of our control.
Unfortunately, yeah.
But we can impact the other risk factors, right?
Absolutely. And it starts with the basics.
Like not smoking.
Huge one.
Yeah, my notes say it makes your blood vessels constrict and then they're more likely to get clogged.
It's true, smoking damages those arteries, makes them less flexible,
Okay.
more prone to blockages.
It's like smoking turns your arteries into rusty pipes.
I like that analogy.
So quitting smoking is like the best thing you can do,
One of the best things, yeah.
even if you've been smoking for a long time.
Even then, it's never too late.
Good to know.
Yeah.
What about a sedentary lifestyle?
Yes, the couch potato problem.
Guilty as charged.
I think we all are these days. We spend so much time sitting,
Yeah.
and it's not good for you.
So it's not enough to just go to the gym.
No, you have to move throughout a day,
Okay.
get up every hour of stress, take the stairs, walk, or bike.
Got it. Stay active.
Exactly.
What about stress?
Stress is a big one.
It seems like everyone's stressed these days.
They are, and chronic stress is really bad for your heart.
How come?
It releases all these hormones that increase your blood pressure and heart rate.
So it's like a constant state of fight or flight.
It is, and your heart can only take so much of that.
My notes say type A personalities are more at risk.
Well, they tend to be more stressed in general.
That makes sense.
But really, anyone dealing with stress needs to find healthy ways to manage it.
So things like exercise.
Yes.
Meditation, spending time in nature.
All of that can help.
Okay.
It's about finding what works for you
Got it.
and making it a priority.
Okay, now for the big one, obesity.
Yeah, carrying extra weight puts a lot of stress on your heart.
My notes say especially around the abdomen.
That's right, it increases your risk of high blood pressure, high cholesterol, diabetes.
All bad news.
There are.
It's like all these risk factors are connected.
They are. They all feed into each other.
Interesting.
That's why a healthy lifestyle is so important.
Makes sense, taking care of yourself in all areas.
Exactly.
Oh, my notes mention oral contraceptives.
Yes.
How do those impact heart health?
Well, they're generally safe,
Okay.
but they can slightly increase your risk of blood clots,
Interesting.
especially for women who smoke or have a family history of clots.
So it's something to talk to your doctor about.
Absolutely.
Okay, so those are the major risk factors, both the ones we can and can't control.
Right.
Now, I want to go back to those heart rhythm problems we talked about.
Okay, the dysrhythmias.
They sound kind of scary,
They can be.
like bradycardia,
Yes.
tachycardia, atrial fibrillation.
Right.
What do those all mean?
Well, remember the heart's electrical system.
Yeah, the one that controls the heartbeat.
Exactly. When that system gets messed up, it causes rhythm problems,
Okay.
which we call dysrhythmias.
So it's like the electrical wiring in your house going haywire.
I like that analogy.
And some are worse than others.
That's right. Some are minor and some are serious.
Let's start with bradycardia.
Okay.
My notes say it's a slow heart rate.
It is typically less than 60 beats per minute.
And that's always bad.
Not always. For some people, like athletes, it's normal.
Hmm.
But for others, it can mean there's a problem.
Okay, what about tachycardia?
Tachycardia is a fast heart rate,
Okay.
usually over 100 beats per minute.
And that can be caused by a lot of things.
It can stress caffeine medications, underlying heart conditions.
My notes say bradycardia is usually treated with atropine or a pacemaker.
Yeah,
And tachycardia is treated depending on the cause.
that's right. There's no one-size-fits-all approach to dysrhythmias.
Makes sense. So let's break down the different types,
Okay.
starting with the ones in the atria.
The upper chambers of the heart.
Right, okay.
You've got premature atrial contractions.
Yes, those are extra heartbeats.
Okay.
Originating in the atria.
Are those bad?
Usually not. They're very common.
Okay.
Often caused by stress caffeine fatigue.
So nothing to worry about.
Probably not, but if you have them a lot,
Yeah.
or you have other symptoms, it's good to check with your doctor.
Got it. What about atrial flutter?
Atrial flutter is a rapid but regular rhythm.
My notes say 250 to 300 beats per minute.
That's right, the atria are beating really fast.
Wow.
Can cause palpitations, shortness of breath, fatigue.
And what causes that? A few things: low potassium, overactive thyroid, lack of blood flow to the heart, even some medications.
So many things.
Yeah.
Okay, now for the big one, atrial fibrillation.
AFib.
This one seems to be pretty common.
It is, especially as we get older.
What is it exactly?
It's a rapid and irregular heartbeat,
Okay.
often described as a quivering or fluttering.
Oh, I've heard people describe it that way.
Yeah.
My notes mention mitral valve disorders.
Yes.
And rheumatic heart disease.
Right, those can both be associated with AFib.
What are those exactly?
Well, the mitral valve is one of the valves in your heart.
Okay.
When it's not working properly, it can disrupt blood flow.
Ah, and that can trigger AFib.
Exactly.
What about rheumatic heart disease?
That's a condition that damages the heart valves,
Okay.
often caused by untreated strep throat.
Interesting. So AFib can be caused by valve problems or even a past infection.
It can.
And what are the treatments?
Like other dysrhythmias, it depends on the patient,
Okay.
but medications can help control the heart rate and rhythm.
Mm-hmm.
And there's a procedure called cardioversion.
Okay, we talked about that before, right?
We did. The use is electrical shocks to reset the heart rhythm.
Okay, so now we need to talk about the ventricles.
Right, the low chambers.
Yeah, my notes say those dysrhythmias are more serious.
They are because they can disrupt the heart's ability to pump blood.
I see it even says more life-threatening here.
It's true.
Okay, so what are the types?
Well, there's premature ventricular contractions, ventricular tachycardia, ventricular fibrillation, and ventricular asystole.
Let's take those one by one.
Okay?
First up, premature ventricular contractions.
Those are like PACs, but in the ventricles.
Okay,
Extra heartbeats,
okay.
often harmless, especially in healthy hearts.
But they still don't feel good, right?
No, they can be startling. You feel a skipped beat.
Yeah,
But if you have a lot of them or other symptoms, get it checked out.
good advice.
Okay, now ventricular tachycardia.
My notes say that's dangerous because the heart isn't pumping blood, right?
That's right. It's a very rapid heartbeat that can disrupt blood flow.
And it says the treatment is cardioversion.
Yes, that's the same procedure we talked about before.
Okay, so what about ventricular fibrillation?
VF.
Yeah, this one sounds really scary.
It is. It's a life-threatening emergency.
What happens?
The heart basically quivers instead of beating.
So it's not pumping blood at all?
Not effectively, no.
And what causes that?
A few things: a heart attack, untreated ventricular tachycardia, heart disease, electrolyte imbalances.
And the treatment is defibrillation drugs, IV?
Yes, it's a serious situation that requires immediate medical attention.
Wow. Okay, so last one, ventricular asystole.
Asystole.
Yeah, my notes say it's also really dangerous and requires CPR.
It does. It's essentially a flat line.
Oh, wow.
No electrical activity in the ventricles.
So the heart's not beating at all.
No, it's cardiac arrest.
The treatment here is epinephrine.
Yes, that's adrenaline.
Okay, so we've covered a lot of different dysrhythmias.
We have.
Now, what about atrioventricular blocks?
Yes. AV blocks.
My notes mention 3 degrees.
For second and third.
Right, what are the...
Well, AV blocks happen when there's a problem with the electrical signals between the atria and ventricles.
Okay.
Remember, the signal starts in the atria and travels to the ventricles.
Yeah.
And AV blocks, that signal gets delayed or blocked.
So it's like an electrical relay race and someone drops the baton.
Exactly.
Okay, so first degree is the least serious.
It is. The signal is slowed, but it still gets through.
Okay.
Often doesn't cause any symptoms.
What about second degree?
In second degree, some of the signals don't get through.
Okay.
So you get dropped beats and a slower heart rate.
And that can cause problems.
You can fatigue, dizziness, even fainting.
Okay, so third degree is the most serious.
Yes, it's a complete block.
Wow.
The atria and ventricles are beating independently.
So the heart's not working together.
No, and that's a big problem.
My notes say it can be caused by medications, a heart attack, high potassium inflammation of the heart.
All of those can cause third-degree block.
And the treatment is a pacemaker.
Often, yes, especially in severe cases.
Wow, we've covered a lot of ground today.
we have.
From the heart's electrical system to all these different rhythm problems.
It's fascinating stuff.
It is, but now I want to bring it back to our listeners.
Okay.
What are some things they can do to keep their hearts healthy?
Well, it really comes down to a few key things.
Okay, let's hear them. Lay it on us. What are the golden rules for a healthy heart?
Well, first things first, if you smoke, quit.
Yeah, we've said it before, but it's important.
It's one of the best things you can do for your heart.
It's like giving your heart a fresh start.
Exactly.
Okay, so that's number one. What's next?
Exercise.
That's good.
Aim for at least 30 minutes most days of the week.
30 minutes? That doesn't sound too bad.
You don't have to run a marathon.
Right.
Just get your heart rate up.
Okay, so brisk walking, dancing, gardening.
Exactly. Find something you enjoy.
Makes sense. So we've got quit smoking, exercise. What about diet?
Diet is key.
Okay.
Focus on fruits, vegetables, whole grains,
Okay.
lean protein, healthy fats.
Sounds familiar.
The Mediterranean diet.
Oh, yes, the Mediterranean diet.
Lots of olive oil, fish, fresh produce.
Delicious.
And it's not just about what you eat,
Right.
but also what you limit.
Okay, so what should we be limiting?
Saturated fat, trans fat cholesterol,
Okay.
sodium added sugars.
So basically processed foods and sugary drinks.
Exactly.
Got it. Okay, so quit smoking, exercise, healthy diet. What else?
Manage your stress.
Oh, yes, stress.
We talked about how bad it is for your heart.
It's not just in our heads.
No, it affects your whole body.
So what can we do about it?
Find ways to relax.
Okay.
Deep breathing, meditation, yoga.
Spend time in nature.
Yes, all of that is good.
And sleep, right?
Sleep is so important.
I love sleep.
Most adults need 7 to 9 hours a night.
Okay, so quit smoking, exercise, healthy diet, manage stress, get enough sleep.
You got it.
It's like the recipe for a healthy life.
It is.
Okay, any other pearls of wisdom?
One more. Know your numbers.
What do you mean by that?
Get regular checkups with your doctor.
Okay,
Get your blood pressure checked, your cholesterol, your blood sugar.
makes sense.
Those numbers can tell you a lot.
So don't wait until you have symptoms.
Exactly. Be proactive.
This has been an incredible deep dive.
It has.
We've learned so much about the heart.
It's a fascinating organ.
It is, but we've focused so much on the physical today.
Yeah.
What about the emotional side of things?
That's important too.
How can we make sure our hearts are not just physically healthy,
Yeah.
but also filled with joy and love and compassion?
That's a great question.
It is, isn't it?
I think it starts with gratitude,
Okay.
kindness, connection
Connection with what?
with something bigger than yourself.
Okay, so nature, spirituality, relationships.
Exactly. Find what makes your heart sing.
I love that. So what brings you joy?
Ooh, that's a good one.
It is what nourishes your heart.
Yeah.
And what can you do today to cultivate more love and compassion?
Beautiful questions.
They are, aren't they?
It's not just about preventing disease. It's about truly live.
Absolutely. This deep dive has really changed how I think about heart health.
I'm glad to hear that.
It's not just about avoiding a heart attack.
Right.
It's about living a life that nourishes your heart
Yes.
on every level.
I love that.
Well, thank you so much for joining us on this incredible journey.
It was my pleasure.
We hope you learned something
I
today
hope so too.
and that you feel empowered to take care of your heart.
Knowledge is power.
It is, and the more we know about our hearts,
Yep.
the better we can take care of them.
Absolutely.
Until next time, stay curious and keep your heart happy.
I love it.
Welcome to the deep dive. Ready to go deep into cardiology? We'll be exploring all those notes you've got.
Sounds good. It can seem a little overwhelming, all that medical jargon.
Right, but we'll break it down, make it fun. It'll be like your own personal cardiology crash course.
Yeah, exactly. Unpacking those complex terms, making the science behind the heart and what can go wrong, more accessible.
Your notes start off with the heart structure, which is a good place to start. The heart as this incredible pump.
Oh, yeah, for sure. It's got all those chambers and valves all working together, making sure the blood flows in the right direction.
It's kind of like the foundation. Once you get how all the pieces fit together, it's easier to see how things can go wrong.
Right, exactly. And you've got a section here on inflammatory heart conditions. Those conditions can really mess with that smooth blood flow.
First up is rheumatic heart disease. It's connected to strep throat. Kind of crazy, right?
You wouldn't think something as common as strep throat, especially in kids, could end up impacting the heart.
It's wild. So strep throat is caused by, what is it called? Group A streptococcus?
That's it, yeah. And if it's not treated, the body can kind of go overboard with its immune response. It starts attacking the heart valves like it's a threat.
So the body's own defenses turn against it. Wow. And there are signs to watch out for.
Oh, yeah, definitely. It's like the body sending out an SOS signal, fever, achy joints, that kind of rash. Could even be changes in their heart rhythm.
So even with something that seems pretty normal, like strep throat, gotta stay vigilant. Okay, so next on the list is infective endocarditis. That one sounds a bit scary, to be honest.
I get it. But think of it like this. Tiny invaders, bacteria, maybe some fungi, setting up camp on the inside of your heart, including the valves. like unwelcome house guests causing chaos.
Okay, that makes it a little easier to picture. So people with existing valve issues, they're more at risk. Also, people who've had procedures like body piercings or dental work, right?
Exactly. It's because those situations can kind of open the door for those invaders, those bacteria and fungi, to slip into the bloodstream. And from there, they can make a beeline for the heart, especially if there's already, a weak spot like a damaged valve.
So even a small infection can turn serious if it makes its way to the heart. It's a good reminder to be mindful of our health overall. Now, myocarditis. It's about inflammation of the myocardium, the heart's muscle wall. So it's like the heart's engine itself is inflamed.
You got it. And just like a car engine can't run right if it's inflamed, the myocardium struggles to pump blood efficiently. What makes myocarditis tricky is that it's got like a whole bunch of possible causes: viruses, bacteria, even your own immune system going haywire, or certain medications.
So figuring out what's causing it can be tough.
Yeah, and the symptoms can be all over the place too. You might feel like you have the flu, you might get chest pain, and in serious cases, even heart failure. It's really important to listen to your body. And if you're experiencing anything unusual with your heart, get to a doctor ASAP.
Sounds like early intervention is like super important. All right, next we've got pericarditis. So that's inflammation of the pericardium, the sac around the heart, kind of like the heart's armor being inflamed.
Exactly. And just like if you're wearing armor that's too tight, an inflamed pericardium can really constrict the heart. Causes a lot of pain and discomfort.
Yikes. So sharp chest pain is a big symptom, especially when lying down. Sometimes it even radiates to the back or shoulder.
You nailed it. That specific kind of pain is a huge clue for doctors. Pericarditis can be caused by a bunch of things, usually viral infections, sometimes autoimmune disorders like lupus, or it even pops up as a side effect of other heart problems.
So many different things can impact that protective sac. It really shows how connected everything is in the body.
It really does. Speaking of connections, let's switch gears a bit and talk about valve problems. They can really throw a wrench into the heart's delicate balance.
Sounds good. So those heart valves are like tiny gatekeepers, huh? Making sure everything flows in one direction and doesn't back up.
They really are. It's pretty amazing when you think about it. But when they don't work right, that's when you get what's called valvular heart disease.
My notes mention two main types of problems, stenosis and insufficiency.
Right. So stenosis, you can think of it like a doorway that's been narrowed. It's harder for the blood to get through, puts a lot of strain on the heart, like trying to push open a door that's stuck. It takes way more effort.
Okay, I get it. And then insufficiency is when the valve doesn't close all the way like a leaky faucet.
That's a great way to put it. You get that backflow, it messes with the heart's rhythm and forces it to work harder. That's what leads to fatigue, shortness of breath, maybe even an irregular heartbeat. Mitral valve prolapse. That's a good example of this.
Yeah, mitral valve prolapse. I've heard of it, but what exactly is going on there?
So the mitral valve, it's one of the four valves in the heart. In prolapse, the flaps of the valve, they don't close properly. They kind of bulge or flop back a little, which leads to that leaky faucet situation.
So not a total blockage, but still enough to cause problems. And my notes mention that if you have valve problems, they recommend antibiotics, like before you get dental work done. Why is that?
Because dental work, it can sometimes let some bacteria into your bloodstream. And remember, those bacteria can make their way to the heart, especially if you've already got a vulnerable valve. It's a precaution, but it can help prevent some serious complications.
Wow, I never thought about that. It shows you how important it is to take care of your teeth, huh?
For sure. It all ties back to overall health. And while we're talking connections, your notes also mention atherosclerosis, which is a big factor in lots of different heart problems.
Oh yeah, atherosclerosis, hardening of the arteries, right? I remember learning about that way back when.
Think of your arteries like highways for your blood. Over time, if you don't maintain those highways, they can get clogged up with plaque, fats, cholesterol, that kind of stuff.
So it's like rush hour traffic, but inside your arteries?
You got it. And that buildup, it makes the arteries narrower, restricts the blood flow, so the heart has to work harder to push the blood through.
And that's where things like angina and heart attacks come in, right?
Extensively. When the heart muscle isn't getting enough oxygen-rich blood, it starts sending out warning signals. That's the chest pain, the angina.
So angina is like the heart saying, hey, I need a break here.
Exactly. Now, with stable angina, it usually comes on when you're exerting yourself and goes away when you rest. But then you've got unstable angina that's more unpredictable and doesn't follow a pattern. That's a sign something more serious might be happening, and you got to get medical help fast.
Like a code red for your heart. And if that blockage gets completely blocked off, that's when a heart attack happens.
Yep. It's called a myocardial infarction. It's when a part of your heart muscle is basically being starved of oxygen and starts to die.
And the symptoms, they're pretty classic, right? Chest pain, it radiates to the arm or jaw. You get shortness of breath, sweating, nausea, sometimes even a feeling like something terrible's about to happen.
It can be pretty terrifying. And in those moments, every second counts. The faster you get treatment, the better the chances of restoring blood flow and limiting the damage to the heart muscle.
Scary to think how quickly things can go south. And even after a heart attack, there's the whole recovery process and the worry about it happening again.
Absolutely. That's where lifestyle changes are huge. Eating a healthy diet, getting exercise, managing stress, those things make a big difference in preventing future problems.
It's all about making those healthy habits stick, huh? Okay, so next up is heart failure, which honestly sounds pretty terrifying just from the name.
I understand why it sounds scary, but remember, heart failure doesn't mean your heart just stops beating. It means it's not pumping as efficiently as it should. It's struggling to keep up with the body's demands.
So it's more like it's getting weaker, like a car engine losing power.
Exactly. It might still be running, but it's not at its best. And your notes mention different types, like right-sided and left-sided heart failure.
Yeah, what's the difference there?
So the heart has two sides, each pumping blood to a different part of the body. With right-sided heart failure, the right side is having trouble pumping blood to the lungs, so you get fluid building up, especially in the legs and ankles.
Like a traffic jam on one side of the highway?
Perfect analogy. And with left-sided heart failure, the left side, which sends that oxygen-rich blood to the rest of the body, it weakens, and you can get fluid built up in the lungs.
Which probably makes it hard to breathe.
You bet. Shortness of breath, especially when you're lying down, that's a common symptom.
So many things can mess with the heart's ability to pump properly. What about treating heart failure? My notes mention meds, lifestyle changes, even surgery.
It's often a combination of all three. Medications can help the heart pump better and reduce that fluid buildup. Lifestyle changes, like cutting back on salt, getting regular exercise, managing stress, those can really improve how the heart functions.
So it's about giving the heart all the support it can get.
Right. And then in some cases, surgery might be necessary. You mentioned CABG earlier, where they use a healthy blood vessel to bypass the blockage.
Yeah, CABG, like building a detour around that blocked artery.
Exactly. And there are other procedures too, like valve replacement, where they swap out the damaged valve for an artificial one. And in really serious cases, a heart transplant.
Medical technology is pretty amazing these days, huh?
It really is. But prevention, that's always the best medicine.
And speaking of prevention, we should touch on aneurysm. It seems like one of those silent but dangerous conditions.
Aneurysms can be tricky like that. They often don't cause any problems until it's too late.
My notes describe it as a bulge or ballooning in a weakened section of an artery.
That's a good way to picture it. Think of a weak spot in a tire that starts to bulge outwards. That's kind of what's happening with an aneurysm. The danger is if that bulge ruptures, then you've got internal bleeding, which can be life-threatening.
Like a ticking time bomb.
Yeah, kind of. And the tricky thing is that aneurysms usually don't have any symptoms until they get really big or they rupture. That's why getting those regular checkups is so important, especially if you're at higher risk.
Catching it early is key. What about treatment?
Well, it depends on the size and where it is. If it's small and not causing problems, they might just monitor it. But if it's big or growing quickly, they might need to do surgery to repair it before it ruptures.
Wow, we've covered a lot of ground today. It's amazing how many different things can affect the heart.
It really is. It just shows how complex and important the cardiovascular system is.
I've learned so much, though my brain feels a little full right now.
I don't blame you. It's been a lot of information. But I think now's a good time to shift gears and dig into some of those fascinating treatment options in your notes, specifically for those big ones we talked about: angina, heart attacks, and heart failure.
Sounds good. Okay, so let's jump into those treatments. It's incredible how far medicine has come in treating heart conditions.
It really is amazing, right? You're going to be fascinated by some of the stuff they do to treat angina, heart attacks, even heart failure.
My notes start with angina pectoris treatment. They mention meds like vasodilators and beta blockers. I've heard those terms, but could use a little refresher on how they work.
Sure thing. Imagine your arteries are like those bendy straws you get at restaurants. Sometimes they get squeezed, right? Vasodilators basically tell those arteries to relax, helps them widen so more blood can get through to the heart.
So they ease the pressure, and beta blockers, those kind of help slow down the heart rate.
Bingo. It's like easing up on the gas pedal, takes some of the load off the heart so it doesn't need as much oxygen. Working together, those meds can really make a difference in those angina episodes.
It's pretty amazing how we can adjust the heart's function with medicine. Okay, so my notes also mention something called PTCA, percutaneous transluminal coronary angioplasty.
Yeah, it's a mouthful, but it's actually a pretty straightforward procedure. Imagine a tiny balloon threaded through a catheter right into the narrowed coronary artery. Then they inflate the balloon and it pushes the plaque out of the way, widens the pathway for blood, like giving the artery a good cleaning.
Sounds pretty delicate, but effective. Sometimes they even put a stent in to keep the artery open.
Yep, it's like a little scaffold they put in there to prevent it from collapsing or narrowing again. It's been a game changer for people dealing with coronary artery disease.
Now, for myocardial infarction treatments, I have this term, MONA. It sounds like a person's name.
That's a good one. MONA is actually an acronym. Stands for morphine, oxygen, nitroglycerin, and aspirin. Like a first aid kit, but for a heart attack.
Okay, let's break it down. So morphine is for the pain.
Exactly. Helps to ease that intense pain that comes with a heart attack. Oxygen helps to replenish what the heart muscle's been missing, with that restricted blood flow.
And nitroglycerin, that's the one that widens the blood vessels, right?
That's it. Vasodilator, remember, helps improve blood flow to the heart. And then aspirin, the good old over-the-counter aspirin, thins the blood so clots are less likely to form.
So it's a four-pronged approach: pain relief, oxygen, improving blood flow, and preventing more clots. My notes also have these meds listed: streptokinase and tissue plasminogen activator. What are those for?
Those are the clot busters. They actually go in and break down the clot that's causing the blockage, like a demolition crew clearing a roadblock.
Powerful stuff. And then anticoagulants like heparin come in to keep those clots from forming again.
Perfect analogy. You got to keep the road clear, right? The goal with all these treatments is to get that blood flowing again as quickly and safely as possible, less damage to the heart muscle. And then, of course, like we talked about, making those lifestyle changes and taking medications to prevent another one down the road.
All right, so moving on to heart failure, my notes mention surgical options. There's CABG again, which we talked about before. Still blows my mind that they can use a healthy blood vessel to bypass the blocked one.
It's pretty amazing, isn't it? They take a healthy vessel from somewhere else in the body and graft it in to create a new pathway for the blood, like building a detour around that blocked road.
Intense. Then there's these intra-aortic balloon pump and ventricular assist devices. They sound so high-tech.
They do sound kind of futuristic, but they're real and super helpful for folks with heart failure. The balloon pump is usually temporary, to give the heart a chance to recover.
How does that one work?
So they put this little balloon into the aorta, the big artery coming out of the heart, and it inflates and deflates with the heart's rhythm, basically helping to pump the blood and take some stress off the heart, like giving it an extra push.
And the ventricular assist device, VAD, that's more of a long-term thing?
Yeah, that's right. It's a surgically implanted pump that helps the heart pump blood. It's a lifesaver for folks with advanced heart failure.
We've gone over so many treatments. It's amazing what medicine can do these days, from meds that fine-tune the heart's function to actual procedures that repair and support it.
Really is remarkable. And, it's important to remember, there are real people behind these treatments. Dedicated doctors, nurses, researchers, all working hard to make a difference in people's lives.
This deep dive has been amazing. We covered so much just from your notes.
Shows that you're serious about learning about your heart and staying healthy. And knowledge, that's power, especially when it comes to your health.
So true. Well, that's the end of our cardiology crash course. We hope you enjoyed it. Remember, this is just the start. Keep learning, ask questions, and most importantly, take care of your amazing heart.
Absolutely.
See you next time. JPR Liebs.